case number, and the increase is just under 1,000, according to the state health department.
This where?
You ask? Well, health officer Dr. Scott Harris says he thinks it's a result of Governor Ivey's statewide mask mandate. He spoke one-on-one with WSFA 12 News anchor Sally Pitts about where our state stands in the pandemic.
Alabama has seen a decline in the daily average of new coronavirus cases over the last week. The state health officer, Dr. Scott Harris, says we are not out of the woods yet.
And we're still, running levels much higher than we were seeing, 2 or 3 months ago.
As schools across the state make plans to bring students back to the classroom, Dr. Harris says he is concerned about what's to come.
I think every person involved in this discussion agrees on 2 things. One is that it's better for kids to be in school if you can get them in school. And also, the more people you have out and about, the more disease transmission you're going to get.
Dr. Harris says health and education leaders are doing their best to weigh the pros and cons. In March, the state shut down schools to slow the spread of the virus. When asked if that could happen again, here's how Dr. Harris responded.
And it's hard to predict the future. I guess we can imagine some, catastrophic situation where, the state steps in to do that statewide. But generally speaking, I think it's much more likely to have a scenario where you have particular outbreaks in particular communities that affect a certain school or a certain school system.
As schools start back up, so do sporting events. Dr. Harris says guidelines for schools to follow are set out in the Safer at Home order. Dr. Harris says he does have concerns about spectators, and while we can make events safer, there's no way to make them completely safe. Sally Pitts, WSFA 12 News.
The Alabama Department of Public Health has provided some new guidance for schools reopening. Reporter Lydia Nussbaum will outline the 85-page toolkit coming up on WSFA 12 News at 6.
Well, weeks ago, the state's hospital association said that Alabama had a narrow window to reduce hospital capacity before numbers started to get out of control. Tonight, reporter Jennifer Horton has a progress report.
Some of Alabama's hospitals are slowly stabilizing following the Independence Day surge. According to Dr. Don Williamson, Executive Director of the Alabama Hospital Association, the state's overall inpatient capacity is shifting.
We're seeing more COVID patients and maybe less of some non-COVID patients.
40% of ICU beds and 27% of adult medical beds are currently occupied by patients. Still, the state is reporting the fewest number of new COVID cases within a month.
If that's true, I think you have to believe that it's the mask order finally showing its effect. That would likely then be demonstrated by a decline in caseloads in hospitals by the end of this week to next week.
Some communities like Montgomery, Dothan, and Birmingham are still working through the July surge. They have less than 10% ICU bed availability.
We need a break so that